Welcome everyone to today's webinar. I am Leo Vardarella with Becker's Hospital Review. We will begin today's webinar with a presentation and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. We are looking forward to hearing your questions. In about a week following the webinar, we will be sending all registrants a copy of the presentation to the email you used to register. Please be patient as the post-webinar preparation of materials can take some time. It is now my pleasure to introduce today's presenter, Suzanne Mowry. Suzanne has been a nurse for 35 years with a bachelor's degree in healthcare administration from the University of St. Francis in Joliet, Illinois. She has served in various leadership roles in nursing over the past 25 years and currently holds the position as Kronos team leader at Mission Health since 2015. At this time, I am pleased to turn the floor over to Suzanne to begin today's presentation.
Good afternoon, and thank you for allowing me to discuss the journey of how Mission Health was able to save over $500,000 by standardizing our workforce management policies and practices. Objectives for this webinar are to understand the importance of transparent and consistent pay policies, discuss the importance of staff education and awareness in managing labor costs, and to examine how data from Workforce Management Solution supports both the employee engagement and controls labor costs. Now let me tell you a little bit about Mission Health. It is an 8-hospital health system serving 18 counties in western North Carolina and the surrounding areas. Mission Health employs approximately 12,000 employees in the system, with nearly 5,000 of them being nurses. Nursing has taken the lead on this project. Mission Hospital is a regional referral center for western North Carolina, a level 2 trauma center, and is licensed for 750 beds. Mission Health was ranked among the top 15 health systems for the 6th time by Watson Health. And where we started, Mission began using Kronos for timekeeping in 2004. We implemented Kronos scheduling and attendance for nursing staff in 2010. Then our CNO gave us the directive to optimize Kronos in 2015. And how this project began, there was a new leadership in the Kronos support team. The team took the first steps to identify the issues of why the organization had an optimized Kronos and what was the barrier. To do that, we interviewed nursing leaders to discuss current perceptions of Kronos and the functionality. And what we found was that about 40% of all employees had a schedule in Kronos in 2015 at the beginning of this project. The one theme we heard from nursing leaders was the software doesn't work. We don't trust the software. It was important to listen to their concerns and then to validate them. To do that, we invited the Kronos team to review the functionality, the setup, and to make sure there was no issue with the software. And what we found fell into 2 main categories. The technical team identified some issues related to the software that needed to be resolved. We engaged the Kronos support team to address those issues. We also learned there were features within the software not being utilized that would make a difference for the organization when it came to efficiency, cost savings, communication, and employee satisfaction. So we developed a plan to implement those. And then some of the things we weren't using was the online self-scheduling, shift swap, open shift, requesting time off, and the mobile app. All of these features make the system more user-friendly for both management and staff. The next step was to review policies associated with timekeeping and payroll for all member facilities. And what we found was there was approximately 23 different policies out there related to timekeeping, PTO, and attendance. There were some contradictions within the policies, and our interviews revealed various practices with implementing those policies. So we established a collaborative group with HR, finance, and nursing leadership to review, revise, and consolidate policies that would apply to all areas where services are provided. The end result was 3 system policies related to timekeeping, attendance, and PTO. Within these policies, we define the desired behavior, expectation, and consequences for the employee. And some examples included to clock in and out according to your schedule, the consequences for excessive time edits, and the definition of how the system defines a tardy. Some of the specific department issues were employees not appearing appropriately on the schedule or the desired shift not available for employee self-scheduling. Overall lack of education was a common theme. When Kronos scheduling was implemented in 2010 to nursing, limited education was provided to the users. We addressed educational needs through providing the manager one-on-one education. We did drop-in sessions and online education. The online module is now being utilized to provide baseline education for all new users of the system. And we created a web page for the staff to have access to educational resources. As we examined barriers to improve system utilization, the number one issue was lack of trust and the refusal to use the software. We focused on improving communication and follow-up on identified issues and questions in a timely and transparent manner. We then established expectations for employees with the support of senior leadership. Mission's culture is to make decisions based on data. Leaders and staff are astute to respond to the data presented. But as you'll see in the next few slides, some of the data available was hidden by standard reports. So for Mission, data is downloaded from Kronos into Lawson and then into Oracle for leadership reports. For this project, we went back to the source, timekeeping system Kronos, and identified early and late punches. It was all about looking at the information available in a new way. Starting at the beginning, we elected to focus on the employee clock-in. This became the focus for our first initiative. One of the tools Kronos provides is a Reconcile time card view. In this view, it shows you everything that your employee is doing. When looking at this screen, we had the idea to dig deeper into the information provided here. We again partnered with finance to determine the magnitude and the costs associated with early, late, very late, in and out. Focusing only nursing, we discovered that early and very early clock-ins was costing nursing $133,000 a month, which equals $1.5 million a year. Another area of concern was the number of canceled meal deducts, not only as a budgetary concern, but a staff satisfaction concern. So our nursing leadership also decided to address this issue as well. They developed a buddy system program to help assure that nurses had coverage for their meal breaks. And also note, with a 40-hour work week, overtime is monitored by management. But most nursing staff that work full-time do a 36-hour work week. So the incidental overtime for these employees do not generate overtime on a traditional report, but however are above budget. Director-specific reports were developed, as well as a graph showing overall results. We established a goal of 0 occurrences for early and very early. We still have opportunity for improvement. This is a sample of the overall results graph. You will note that we started with 3,600 occurrences per month, but we were able to reduce that to 1,200 per month the first year. Kronos counts missed work as absences in the attendance module. It is already set up to count tardies, adding attendance points for each late clock-in. In the future, Mission plans to implement attendance points to assist managers in monitoring and enforcing early clock-in and to build accountability at the employee level. This is a sample of a director-level report. It established some friendly competition to motivate directors towards progress in their areas. Another key component that helped motivate the results we obtained was educating staff on what the hospital was spending on incidental overtime and how important it was for them to clock in according to their schedule, and then other details of the system policy, and then the desired behavior we wanted from the employee. The schedule is a key component on how we obtain the data. When the project began, we estimated approximately 40% had a schedule in Kronos. Employees must have a schedule in Kronos to identify early and late punches by the timekeeping system. Expanding this project beyond nursing means implementing scheduling in other areas. Many more departments have been added, and others are in various stages of implementation now. Our goal is to achieve 100% hourly employees will have a schedule in Kronos. And in summary, what we learned was the tools were there for us all along. We weren't using them. As an organization, we need to look at the processes and the data in a different way. As with any project, you need a champion leader to drive the project and achieve the results. For this project, it was nursing. We built trust in the tools by listening to the nursing leaders' concerns and validated their concerns with the help of the Kronos team and addressing issues in a timely and transparent manner. We followed that providing proper education, giving the tools to be successful. The Kronos team remained a valuable resource for questions and concerns, and most importantly, maintained open communication. Establishing a system policy for timekeeping, attendance, and PTO, the foundation was laid that defined clear expectations for all employees. By doing these few simple changes, we were able to save $500,000 for the nursing division at our main facility, and as a result, we saved jobs. We have since rolled this project out to other departments and member hospitals. Next steps for Mission Health is to continue to focus on all hourly employees to have a schedule in Kronos, as scheduling is a key component at managing labor costs. We're also focusing on efficiency opportunities and beginning a project to streamline and centralize the timekeeping and scheduling process. Again, nursing has taken the lead with 24 departments already participating at various stages. Mission Health is open and interested in exploring more opportunities for improvement, efficiency, and cost savings. And at this time, I'll open up to any questions.
Thank you, Suzanne, for that fantastic presentation. We will now begin today's question and answer session. Please submit any questions you have by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. We will try to get through as many questions as we have time for. Our first question of the day is, how did you build trust in the Kronos solution and its data?
And really, we built the trust with the Kronos solution by really going back to the nursing leaders and listening to them. The one thing back in 2015 when we first started to optimize Kronos was they just didn't trust the software, and they actually had every right not to. We had issues that were related to the software, but with the help of the Kronos team, we were able to identify those issues. So it was really back to listening to the leaders with their issues and validating them, and the constant communication that we provided.
Thank you so much, Suzanne. This audience member asks, why the focus on early in/late out punches?
And so back when we were looking at how could we optimize Kronos or what could be any kind of cost savings, the one thing that really stuck in our mind was that Reconcile time card. And when you look at that Reconcile time card view, it really tells you everything that your employee is doing. Missed punches, early ins, late outs. And so we as an organization decided what is the very first thing that employee does, and they clock in. And so our focus became on that little bit of incidental overtime, and if we could get the schedule in Kronos correctly and have hold the employee accountable to clocking in and out accordingly, that we might possibly be able to save money.
Thank you so much, Suzanne. So this audience member wants to know what departments outside of nursing are using Advanced Scheduler?
So right now, our goal is really for any hourly employee to have a schedule in Kronos. But other areas that using that advanced scheduling where the employee is able to sign up on their own is we have lab, food and nutrition, EVS, respiratory. So a lot of departments in the hospital are using Kronos scheduling.
Thank you. And where are you in the centralization of timekeeping and scheduling?
So for our centralized timekeeping, we actually started at our main facility, and we now have 19 nursing units up with doing centralized timekeeping. We are just beginning the beginning phases of doing the centralized scheduling. So we are just doing a pilot of 2 units with that right now. Our plans of we've reached out to, we have 5 member facilities, and we are up with 1 member facility doing all of centralized timekeeping.
And can you share what efficiency processes you are focusing on?
Efficiency, when it comes to the centralized timekeeping, a lot of things that we found was when we rolled out Kronos, since we did lack of education, the thing that we really focused on is make sure that the coding of your time card is correct. And we've eliminated paper. So we've gone to an electronic time and edit form.
Thank you. Great question and a very informative answer. This next audience member is curious how you defined tardy.
For our organization, we have a 7-minute rule. So it's 7 minutes after your start time.
And our next audience member is curious, what areas are using advanced scheduling versus standard scheduling?
So a lot of the areas that use advanced scheduling, one is nursing, but we also have it where it's in, the PACU, the OR, laboratory, respiratory. A lot of those departments use the advanced scheduling.
And you also mentioned Oracle. Are there technologies used to present the Kronos data in an easily digestible format? Have you considered a dashboard technology? This audience member wonders.
Yes, we do have a labor management dashboard that we use the Kronos. But it's our labor management tool dashboard is just for nursing right now.
Gotcha. And do you find the younger staff are more satisfied with the web accessible platform?
Don't have any feedback on
that. I would have to say I don't have much feedback on that.
Thank you very much. Are you able to describe the number of resources you have that support the application, i.e. educate, configure, etc.?
Right now, we have an iTeam support, and we have, we actually partner with IT, payroll, and HR.
Thank you so much, Suzanne. Is the early and late clock-in report a customized report created to you by Kronos, this audience member wonders?
No, it's just data that we're able to pull out of Kronos through Oracle.
Thank you so much. Another question we have from the audience is there a dedicated FTE to monitor your all nurses clock in and out, or is it done by the unit director?
It's done by the unit director.
Thank you so much. And what version of Kronos are you using?
7.08.
Thank you. What challenges were there with specialized departments such as OR, pre-op, and PACU?
I think when you're putting a department up on scheduling, you have to actually really listen to their needs, and so then you really customize it to what they want to get out of Kronos and what they want to get out of the schedule. And so if you think about it, a lot of the nursing units are the same. They have 12-hour shifts. So your other areas are different, and you might have to use shift labels because they might want to know that someone's working in the PACU or the OR or in same-day surgery. So you actually customize it to their needs.
Thank you so much. We've received a ton of great questions, and this next one is, what type of activities do you use to get the culture focused on employee accountability with following policy/timekeeping protocols?
I think for that is really the education. And so for this project that we did, I think for it to be, the way it was so successful was really letting the employee know what their expectations were. And so when I said we had 23 different policies out there, we narrowed it down so there was one policy system-wide so that every employee was held accountable to the same expectations. And then letting your employee know, this is the reason the hospital is focusing on this, because we want to save money. And it was as soon as you explained that to them, they kind of understood, and then the culture kind of changed.
Thank you so much. How many FTEs do you have dedicated to building and maintaining your Kronos Advanced Scheduler?
2.
And payroll does
Two FTEs that work on the Kronos, helping the units, the centralized timekeeping, the scheduling, and going out educating. Then we have the help of IT, and then the help from payroll.
Thank you so much. This next audience member wonders, do leaders get notified via email or text when there are exceptions to review?
No.
They run their own reports.
Thank you.
So really what our nursing leaders do is they actually generate their own reports. So they have the ability to go in and run the reports and get the information out that they want.
Thank you so much. Well, unfortunately, this concludes today's program. I want to thank Suzanne for her excellent presentation and to our audience for participating. Enjoy the rest of your day, and we look forward to having you join us for future webinars.